All right, good evening, everyone. Thank you so much for taking time out of your evening for us to get together and basically just working to get some of your questions answered. We want to make sure that you have the most up to date information and that you are doing everything within your power to keep you and your family and your loved ones safe. My name is Delegate Marcia Price, and I have the honor of representing the 95th House District, most of which is in Newport News, a tiny, tiny part of Hampton, but you are welcome on this call if you're in the 95th or not. We have gotten some really great experts from the local, state, and federal levels to try and answer some of the questions that we have been hearing in our emails, but also on social media, trying to have this conversation together. We do have press present, and you are welcome, and also welcome to ask any questions. And if you feel like your question wasn't answered, be sure to text me if you're press. And then, of course, just want to offer our condolences to the families of the Virginians that have died from this disease. Send a special shout out to the medical professionals and the health professionals that are on the front lines of this, and just really just underline the seriousness with which I hope that we are all taking this. So again, thank you for your time here. We're gonna have some questions at the end, but some housekeeping things. Everyone is muted right now, so we are trying to get all of the questions into the chat. If you're fine asking your question to everyone, you can use the chat and send it to everyone. But if you want to send a private question, send it to my Chief of Staff, Tempest Boone. And we will also have some questions that were emailed to us. But each of us is going to go through and have a couple of minutes just to kind of share an overview. And then at the end, we will definitely take your questions. So that is our agenda. And then if you're by phone and you have our email address and you have not emailed in your question, please do that so that we can try and get as many questions as possible. But know this, we're recording this, so we will put that back up and post it so you'll see the video. And we're also going to use your email address to send you a follow-up email that has links and information from all of the presenters. And if there's a question where there isn't an answer on tonight's call, we'll send that as soon as we get the answer from some of the state agency folks. So please bear with us. We might not get every single question done tonight, but we'll do everything within our power to get your questions answered. So first up, we're going to discuss social distancing. What are some of the precautions? Why is this so serious, especially if you're in the Hampton Roads area, or what is known as the Peninsula Health District? And so I am going to unmute Dr. Steve Julian, who is the acting director of the Peninsula Health District. Dr. Julian, take it away.
Good evening, everyone. Thank you, Delegate Price. Thank you for the opportunity to be here. So what I want to talk about is the need to focus on understanding how this virus is transmitted. It is transmitted through droplets, through coughing, sneezing, saliva. The droplets are usually in the air and somebody breathes them in. And in doing so, the virus then penetrates the linings of the nose, mouth, throat, and tends to set up housekeeping, unfortunately, in the lungs. It then causes damage to the lungs, which causes cough, shortness of breath, and of course, during the invasive phase, a fever. So fever, cough, shortness of breath, these are the main signs. The importance of social distancing comes in with how the virus is transmitted. It is transmitted from person to person, though it can be transmitted from surfaces, though that is not the primary mechanism. The virus can live on surfaces for a while. A lot of research is coming out at the present time, understanding how long the virus can be viable on surfaces, but I think that is not solid information at this point. I think it's prudent to clean surfaces frequently with disinfectants. And of course, hand washing is incredibly important. 20 seconds is longer than you think, but that's how long you should wash your hands. And you should wash your hands frequently, especially when changing tasks or being involved in outdoor activities or activities at the grocery store and things of that nature. Use hand sanitizers when hand washing is not available. Hand sanitizers are good, but hand washing is better. What we're trying to do with this by social distancing, and by that I will define as trying to keep a distance of about 6 feet between yourselves and other persons, is to prevent the spread of this disease from person to person. It's very important to stay out of large crowds, no gatherings over 10 people, pick up your food at drive-thrus and at the grocery store, and cook at home. What we're trying to do is bend the curve. And I'm sure many of you have heard that statement. We're trying to decrease the spread amongst people so that the number of people who will contract the virus will be decreased. And also the number of people, of course, then who will die as a result of contracting this virus will be decreased. As examples, in Singapore, a very good social distancing activity and appropriate hand washing and so forth was done. And they have a very flat curve. And a different example is Italy. Italy has a very steep curve with a high rise in cases and a large number of cases and many deaths. What we want to achieve with all our social distancing activities and reducing unnecessary travel is to decrease the spread of the virus and flatten that curve so that fewer people are sick and fewer people die. There are high-risk populations, and that's usually folks older than 65, or people with underlying medical conditions, such as diabetes, heart disease, asthma, or chronic lung disease. That being said, young people can get this virus too. About 20% of the victims of this virus are between the ages of 64 and 20. So do not think that this cannot happen to young people. It's very important, if you feel ill, not to go to work. Seek medical professionals' attention. It's very important not to go around those who are sick, not to visit hospitals, and not to visit nursing facilities and the like at this time, because we do not want to spread this to our vulnerable populations. It's really important to stay safe. Social distancing doesn't necessarily mean social isolation. We have a lot of ways nowadays that you can communicate just like we're doing tonight. And so don't forget about each other. Reach out, make phone calls, keep in touch, and get together over video chats like this. I'll be glad to answer any questions as we move forward in the presentations. Thank you for your time and attention.
Oops, I almost touched my face. Thank you so much, Dr. Julian. And thank you all for the hard work that the health department is doing and all of the great resources that you all have in trying to keep us safe. So now we're going to go to the federal level response. And we have with us Congressman Bobby Scott, who is with the 3rd Congressional District. And if you're in Newport News, all of Newport News is within that. Congressman Scott, take it away.
Thank you, Marcia, and thank you for having us. It's important that we get actual facts, not speculation and hopes and aspirations. This is a very serious problem. As we just heard, the curve is so important. And just as an example, during today, the number of deaths in America went up 10%. Just last Friday, the number of deaths was in the 200s. Now it's over 600. It's doubling every week. So in a month, that means it goes up tenfold. Next month, another tenfold. So instead of 600 now, this time next month, 6,000. Next month, 60,000. And that's the problem. It's not the number of deaths and number of infections today. It's the curve you're on, and we need to, that's when they're talking about bending the curve. Just a few weeks ago, the president asked Congress to appropriate $2.5 billion, totally inadequate. Half of that was reprogramming money that was already there. Congress passed a bill of about $8 billion, beefing up federal agencies to deal with this problem. About a week ago, the House passed the Families First Coronavirus Response Act, which had 3 essential parts. First, it made sure that you could get a test without any copay and deductible on your insurance. And if you don't have insurance, it's free. We had a nutrition part focused on school lunches. Many of our school children get most of their nutrition from school meals. And if they're not in school, as many states, I think 38 states have closed schools, including Virginia, we need to make sure that that nutrition gets to them. So we passed legislation and funding to make that happen. And that's not a difficult thing for schools to do. They do it during the summer. So if they want to know how to get food to students during the shutdowns, just do what you did last summer and it'll work out. We also simplified WIC to make sure that the Women, Infants, and Children program is not hurt by this virus. And finally, we had paid sick leave, two weeks sick leave if you leave your job because of illness or because of quarantine, that you can get 2 weeks sick pay. We also had a part in there for paid sick leave, which was not nearly as generous as we had hoped. By the time it got through, there are a lot of exceptions, and we're in the process now of trying to improve that. Our next steps, Governor Northam has issued several executive orders following through on some of the public health recommendations. But our next is to try to beef up unemployment compensation. If you lose your job because of a shutdown, because the business can't operate during this epidemic, you will get unemployment compensation. In Virginia, that is woefully inadequate, and we're trying to beef that up so that it will be significantly more than it is now. Now I'm not going to go into much detail on this because it's still being negotiated, as you know, in the Senate, but unemployment compensation is one of the important things. We're trying to improve the family and medical leave part, give debt relief so that, that particularly on student loans, so that you can get relief there, assistance to education, and checks going out. I'm not sure they've decided the amount, but it's in the range of $1,000 for every adult and some more for children. The important parts, though, are the beefed up unemployment compensation, because you'll get that every week during this epidemic. There is one provision that we're having trouble with that I think is extremely important, and that is voting assistance to states to beef up their voting. There are, if this thing is still going on in November, we need to make sure that people can vote by mail. That's a very expensive process, but we don't want to have happen in November what happened in Ohio, where the night before the vote, the governor just canceled the election. We don't want the November election canceled. If we plan for it, we can have the election. We can have a lot of vote by mail. You can extend the voting time. There's a lot you can do to make sure that the election can take place, but you can't do it if you wait till the night before and decide whether it can take place. And so we need significant funding, and we're pushing very hard to make sure that that happens. But that's what's going on the federal level. And as we're talking, the Senate is looking at their bill. The House has a much more generous bill, but I think the action is going to start off in the Senate.
Thank you, Congressman Scott. And we definitely appreciate your steadfastness and your work up in DC against some pretty steep odds, but really doing work that's helping all of us. And Congressman Scott is going to stick around in case, all of us will stick around in case you have any questions. But now we want to hear from a local government response. And we have with us the mayor of the greatest city in Virginia, but we have the mayor, the best mayor in Virginia as well, but Mayor McKinley Price, and he's going to give us some local guidance.
Good afternoon, good evening, everyone. I just want to run through some things that the city is doing. First of all, as far as city services, all of the city offices and facilities and buildings are closed to the public. The city employees are still at work, and the essential city services are continuing. All city-sponsored events, programs, classes, and activities have been canceled. The voter registers office is urging citizens to utilize online services for the upcoming general election on May 5th. The state law requires voters to have justification to cast an absentee ballot, but the officials have determined that the coronavirus outbreak qualifies as a valid reason for everyone. So voters who do not wish to submit their absentee ballot by mail, the Newport News Voter Registers Office is offering curbside services. The Four Oaks Day Service Center is closed, but services to the homeless community is continued And the staff is in the field partnering with the Salvation Army and Link to deliver food and supplies to places where known homeless individuals find shelter. Our city parks, however, remain open at this time, and they are a critical outlet for people. The Newport News Waterworks is suspended, shutting off water for non-payment. And the Newport News Public Library is promoting their e-membership and sharing online resources and learning tools with residents and city employees. As far as our schools, Governor Northam extended statewide school closures for the rest of the school year. Instructional plans for students are online, and print copies were distributed to families who needed them. A variety of at-home learning resources are available online, including resources for English language learners and special education services. A limited number of Chromebooks are available for checkout to secondary school students who do not have access to a smartphone or other device at home. The school division is working on getting additional devices and hotspots. The public schools is also providing meals to go for any student in need of lunch or breakfast every weekday. As far as communications, the city's 311 contact center is available for residents and is providing information on essential city services during this time. They are also addressing rumors and ensuring our citizens have information they need to stay safe. The city also established a COVID-19 webpage to share information on closures, online city resources, and ways to stay safe. We are also vigilantly monitoring social media and responding to questions and concerns. Newport News Television created programming to provide information for residents, including an interview with the emergency coordinator from the Peninsula Health Department. There's also a mayoral message to citizens on that is airing on NNTV and is posted on our website. The city also develops and distributes a daily newsletter, which goes to nearly 57,000 subscribers. Information on the coronavirus and resources is included in every issue. And you can also get archive issues if you need them. The city also developed custom posters and flyers for every city facility, highlighting the importance of proper hygiene and to stop the spread of the virus. We posted this graphic online and shared it in a newsletter so that it can be downloaded and hung in city businesses. We are also sharing virtual resources that entertain people quarantined at home. Many of our local museums are offering daily programming for audiences of all ages. And lastly, the Newport News Emergency Operations Center is the site of our Peninsula COVID-19 Operations Center. So representatives from 6 municipalities on the peninsula, Newport News, Hampton, PRECAUTIONS, York County, James City County, and Williamsburg, are coordinating response efforts at this location. We are finalizing plans for a weekly Facebook Live series to discuss the city's response to the coronavirus and resources, as well as answer citizens' questions. And we hope to launch that series this week. We're identifying also ways to engage our citizens online, especially our young people. Thank you.
All right, thank you, Mayor Price. And the City Council had an emergency, a meeting to talk about their emergency, and they ended up using electronic means as well. So government, we're having to force ourselves into new ways of doing business because this is truly uncharted territory for so many. Next, we are going to head to food access. And so I'm going to unmute Karen Joyner, the CEO of the Virginia Peninsula Food Bank, and Renee Figuerel with her. Give me 1 second, Renee. Okay, Karen and Renee, are you there?
Yes, I am. This is Karen.
Okay. Karen, you go on, and I'm working on helping Renee.
Okay, I will do the statement, but I would like her unmuted for the future. The Virginia Peninsula Food Bank is open and operating. We're considered an essential business, life-sustaining, and our main priority is to continue operations for as long as possible. With that being said, we made the difficult decision just this week that we are canceling all volunteers coming to the food bank. That is a very hard decision for us because we have so much work that has to be done and so little staff members to do it. But we felt it was important to make sure our staff feels healthy and comfortable coming into work every day. So we're going to have packing parties with our staff from time to time to make sure that we can pack our food boxes and our backpack bags for children. That being said, I'll go through quickly some of the programs that we operate and any changes to those programs. Our biggest program is our partner agency distribution. We rely on about 140 different, mainly church food pantries up and down the Virginia Peninsula. Many of these pantries are, I'll say, manned by older volunteers and have chosen to close. But so far it is not a significant number, but we're monitoring it day by day. They are still available. They are still able to come to the food bank to pick up food. We are also delivering food in very many cases, more than we were prior to this situation. But we are running out of donated food. We were down about 25% on our donated product from last February going into this situation. And with the run on the grocery stores, there was very little for us to get from the grocery stores over the past couple of weeks. So we are starting, well, we haven't just started, we have purchased food. A couple of weeks ago, we ordered a couple of truckloads of food. However, the supply chain is so backed up in the food area that we still have not received what we ordered a couple of weeks ago. We expect to receive some locally purchased food within this week, and that will certainly help our partner agencies. It'll also help our mobile pantry program, which is how we're going to rely on getting more and more food out over the next foreseeable future. Our mobile pantry is converting to a low or no contact protocol where we ask people to drive through the line, and our volunteers and our staff will simply ask them to open the trunk, and we put the food in the trunk and they're on their way. We had a very, very successful mobile pantry at an Achievable Dream this morning. We're seeing a significant increase in the number of households who are accessing our mobile pantry program. Normally that particular mobile pantry would have about 220 households. Today we saw about 300 households, and we expect that to grow further. This week, our next mobile pantries that are already scheduled mobile pantries are at the VA Medical Center in Hampton, where we're going to utilize the Hampton University Convocation Center's overflow parking lot. We've gotten permission for that. And Peninsula Dream Center will be Thursday afternoon. We are working with our local officials to schedule future very large food distributions in all the cities, all the major cities up and down the Virginia Peninsula. And we will have a schedule that we will announce to different media, Facebook, however we decide that we need to do that. We will make sure that people know where they can get food in this way, because that's going to be the majority of the food that we distribute going forward as more and more of our partner agencies have to close. As far as our child nutrition programs go, We are still operating our backpack program. These are bags of food for children to take home over the weekend when they're out of school. So we are currently distributing about 1,300 of these bags this week and last week, 2 locations where the children are going to get the grab-and-go bags, the grab-and-go bags from the public school system. So we are dropping the backpacks off at the end of the week so that when they come and get those school lunches, they also have some food for over the weekend. We have chosen to not take orders for our SHARE program. This is a program where individuals can purchase a box of food for about half the cost of what that food would be. Made that decision because we don't know what 5 weeks down the road is going to bring, what our resources are going to be. And the orders would be taken throughout April, but not distributed until the last Saturday in April. And things are changing so fast and furious that I couldn't have our staff and people having expectations that we're not sure that we're going to be able to fulfill. So right now, the best way to get food assistance and the way that we are pointing everybody to is to participate in one of our drive-through mobile pantries. And like I said, we are planning to have a lot of these mobile pantries in each city up and down the peninsula, starting with Gloucester on Monday. And I think that's all, unless people have questions, but we are planning to be here for the till the end, and we just have to purchase food and stay healthy.
So,
Thank
hey,
you,
Kara, we do
Delegate
have a few
Price.
yeah, thank you. We do have a few questions that we'll ask at the end, but I wanted to see
Okay.
if Renee had any questions because I think she got unmuted. Renee, did you want to add anything?
No, I think everything that Karen covered everything.
Okay, perfect. So we'll keep you all on for any questions. We did have a few good questions pop up, but we want to make sure everybody presents as well. Let's see. And so thank you all so much. Now we're going to hear from some good folks with the Virginia Department of Education, and they are going to be speaking. I first want to say they already know about all of the questions about graduation and the, I mean, just real emotion that comes with shutting down schools when it's your senior year, or even, I mean, I'm hearing from 5th graders that are like, but wait, what about my ceremony? So we get it, we understand, but we also want to hear from them on, I'm sorry, that is supposed to say Dr. Leslie Sale and Emily Webb. I apologize for that. But both of you all are unmuted. You can use your time as you'd like, but we are so thankful that you all took time to speak to the 95th District, knowing that you all work statewide. So thank you so much for being with us.
Thank you, Delegate Price. This is Emily Webb for those who can't see me. On behalf of the Department of Education, we appreciate the invitation to tonight's briefing. Dr. Sale and I will be able to hopefully address some of your questions and provide you some high-level information, but also this is an evolving situation, so we will be sure to keep you updated as things change as well. To ensure the safety of citizens of Virginia, during the outbreak yesterday, Governor Northam did announce the closure of schools for the remainder of the academic year. While the health and well-being of students and staff remain the top priority for the Department of Education, we also recognize the incredible strain that this extended closure places on parents, communities, and local school divisions. Like all educators, we certainly are devastated ourselves that the end of the school year came so abruptly and is just really disrupting the lives of our schools, our staff, students, and families. One thing I will note, child care centers are not impacted by the governor's order to close schools. These sites should make closure decisions in coordination with local health departments. Governor Northam has asked daycares to prioritize essential personnel and adhere to social distancing, new cleaning protocols, and limit group sizes to 10. We know that the impact to students and families during an extended closure is significant. The learning time and support students receive at school are not easily supplemented or replaced. We do understand that. We also understand the desire and responsibility of parents and educators to provide continuity for every student in their thinking and learning, and many school divisions are currently assessing the feasibility of providing online learning given the extended closure of school. VDOE is encouraging schools to thoughtfully evaluate their approach based on community needs while understanding their obligations and maintaining the standards for delivery of instruction and student supports. Initial guidance from the department was issued yesterday on graduation requirements, awarding of credits, and continuity of learning. We're working on issuing additional guidance to help local school divisions execute plans to continue instruction while ensuring students are served equitably regardless of income level, access to technology, English learner status, or special needs. These options will include virtual learning, additional instruction through summer programming, and integrating instruction into coursework next year. For graduating seniors, the Superintendent of Public Instruction, Dr. James Lane, will provide as much flexibility as is prudent and allowable under the code for those students graduating this year. Flexibility provisions will need to consider students facing barriers to graduation. Some credit-based graduation requirements are in the Code of Virginia, and while these cannot be waived outright, we are looking for ways to address them through new instruction and pursuing alternative pathways in forthcoming Board of Education guidelines. Staff is also exploring options to waive some of those code requirements through General Assembly action. For students enrolled in high school credit-bearing courses graduating in 2021 or after, so next year or later, school divisions must award standard credit for high school credit-bearing courses by ensuring that students have completed the majority of the required standards, competencies, and objectives, including those that are essential to success in subsequent coursework. This process must be based on forthcoming revised guidelines provided by the board on the alternatives to the 140 clock hour requirement that earns a student a standard unit of credit. For students in grades pre-K through 8, school divisions must ensure that students are equitably prepared for success in subsequent courses. Local school divisions should focus their efforts on identifying specific core content areas that had not been taught as of Friday, March 13th, and develop an equitable plan to incorporate missing content into core content areas into the curriculum for all students. While specifically Newport News Public Schools is working on its plan to address the extended closure, they do have some resources now. Learning opportunities are available to students on their COVID-19 academic plan webpage, and I did provide that link to Delegate Price's staff to share afterwards. Elementary students have a full 10 days of activities posted on this site. Secondary students receive assignments directly from their teachers via an online learning platform or via email. Middle school students are able to access their learning packets online. To assist students, all teachers are holding office hours each day via email. I'll also note that the Newport News School Board is meeting tonight and will be sharing more details about their division's learning plans in this coming week. For state testing, the Virginia Board of Education is seeking a waiver from the federal government to waive state mandated tests. Additionally, DOE staff are evaluating options related to the suspension of spring SOL testing, given its impact on student graduation requirements, school accreditation, and federal accountability. More information will be released soon on these testing options. While I wrap up, I do want to thank each of you for your patience and understanding as we move through this unprecedented process. Our team is working diligently to provide guidance to local school divisions and parents as quickly as possible. We have provided additional links and information to Delegate Price and her team to share with you after our call today, including a parent resource guide and a webpage with frequently asked questions that is updated at least twice a week, if not daily. With that, I will turn it back over, and Dr. Sale and I are happy to address any questions.
Thank you so much. And yes, we are looking forward to hearing some more information from the Newport News School Board, the Hampton School Board, on the local, proclivities and different things. And I know that we had some questions about education. So if you all can stick around, that'd be great. And thank you for all that you all are doing. So next we're gonna hear from Tram Nguyen, who is the co-director of New Virginia Majority. And it's really interesting sometimes when people are talking about, trying to get food access, or we're talking about life and death measures. Sometimes you forget the importance of the other parts of the world continuing, and that's democracy and our 2020 census. And so we wanted to hear from her on why that's still important, even though we're going through this crisis. Tram, thank you.
Thank you, Delegate Price, for having me, and it's a pleasure to join you all tonight. Democracy and participation is just in our DNA. We have found over the years that it's so important that we make our voices heard to all of our elected officials at the federal level, at the state level, and the local level. And because we have seen how big of a difference that can make on a whole host of policies that affect our community, whether that's public education, whether that's criminal justice reform, economic opportunity. It all really matters. And so when I think about what this COVID-19 crisis has, the effect that it has on our democracy, I mean, Congressman Scott mentioned earlier about how important it is to get some resources down to states to make sure that we can have full participation come November. But then also, as Mayor Price had mentioned, that there is a local election that you all are participating in Newport News and in over 50 localities across the Commonwealth. So I'll start there, and then we'll talk a little bit about June and November elections too. Virginia is blessed in that we have elections every year, and in many years we have multiple elections. I think this year the only month that there isn't an election of some form or another is the month of August in Virginia. So we love our elections. So that being said, in May, the Department of Elections has essentially put out, as Mayor Price said, that this current moment, people can use the 2A excuse, which is in the presence of an illness or sickness, that you could be eligible to vote absentee. So that is what is currently in place for May. There is in-person voting still available for folks who want to show up in person or who need to be able to vote because they need to use equipment for folks that are physically disabled or have some accommodations that they need. So that is still an option, but by and large, folks are encouraged to vote by mail and to request an absentee ballot to be sent home to them. There are a couple of ways that you can request an absentee ballot. You can fill out a paper absentee ballot application, sign it, and mail it into your registrar's office. You can scan or email it. And you can also apply for an absentee ballot online. If you go to the citizen portal on the elections website, that's elections.virginia.gov, you can fill out your personal information. And once your voter record pulls up, you can request an absentee ballot online, and the registrar's office will mail that back to you. That period has started. It actually started last Friday, so it is open for you to request your absentee ballot to be mailed to you right now. And as soon as you get it, you can fill it out, sign the envelope, have a witness sign it, and mail it back in, and your ballot will be processed by the registrar's office. And I'm sure folks are also wondering what impact this will have in June and November. We have June primaries on June 9th for both Republican and Democratic candidates across the state. And then we have the November 3rd general election. I will say that there are a lot of questions still up in the air. There are a number of good voting bills that have passed the General Assembly and are currently sitting on the governor's desk. And we are taking a look at those to see what changes can be made in terms of making sure that we ease access to voting for the June 9th primary. But in the absence of that, know that there are laws that will be signed by the governor that will make it easier for folks, at least in November, to vote at home. On July 1st, after the governor signs the bills as they stand that are on his desk, Virginia will have statewide 45-day early voting, no excuse absentee voting. So you don't even need to use the 2A sickness or illness excuse anymore. It's just available to everybody. So that will be certainly encouraged, and there will be in-person voting, at least at this point as well. So that's the democracy front. It is so important. I mean, decisions are being made at the local level, at the state level, and at the federal level. And it's really important that our elected leaders really understand that we care, right? And we're participating in meaningful ways. Along those lines, we're also in a census year, right? The 2020 census is so critically important for a couple of reasons. There's decisions that are going to be made around hundreds of billions of dollars from the federal government that will be allocated to states and localities. And it'll determine where we build new schools and roads and infrastructure for our communities, as well as how much funding goes into programs that are critical to the social safety net, such as Medicaid and Head Start and block grants for community and mental health services. So it's really important for those reasons, but it's also really important for redistricting. The census determines how many legislative districts or congressional districts are allocated to each state. And the state also uses that census data to draw its state legislative districts. You all should have received a piece of mail from the US Census Bureau over the last 2 weeks to complete the census form. The majority of people will return the form online. But you can also fill out your census by phone and by mail. So if you don't have internet at home and you're calling in this evening, and that's like the best communications tool that you have right now, you can absolutely just call the phone number and return your questionnaire that way. Now, it's important to note there are 9 questions on the census. There are 9 questions that as the filler of the census form you will answer. The first question is the number of people in your household. How many people do you consider a part of your household? And so you'll answer that. And the second question, they'll ask you again, are there any other people that you might not have included, to get you to think twice to make sure that the count is as accurate as possible. Then they'll ask you what type of dwelling you live in. Do you live in a house? Do you live in an apartment? Do you live in a mobile home? You fill that out. Then they'll ask for your telephone number and your name, and that's only to contact you if they have a question on something that you answered, but otherwise it's not going to be shared with anybody. It's private data. The US Census Bureau will not share it with any other agency or with any other jurisdiction. And then they'll ask you a couple of demographic biographical information like your sex, your age and your date of birth, whether you consider yourself of Hispanic origin, and then your race. Now, we've had a lot of people ask questions about and had concerns about those last 2 questions, given there was a lot of news around whether or not this would be a back-end way of asking for or getting people's citizenship data. And that's not what this is. This information has always been asked on the census, and it's important for a couple of reasons. One, when we think about redistricting and we think about whether or not we have fair representation and that whether or not there's racial gerrymandering and over or under representation, we really do need to capture that demographic information. And it also helps us determine whether or not language access is needed for certain programs, right? Because we're looking at the threshold of folks who are foreign-born, who are of different races. So those questions are super important. So once you fill out those 9 questions for yourself, then you'll be asked, the second person in your household, or the third person in your household, and the fourth person in your household, similar demographic information. So it's actually quite simple. I did mine last week and it took me 3 minutes, and it's super easy and quick. And if you have any questions, there's information and hotlines available for you to get that information.
Awesome. Thank you so much, Tram. And did you tell us that it was extended, the census? Oh, wait. Hold on. I muted you. Sorry. Okay, go for it.
Yeah, so the census, because of the current COVID-19 situation, the census is actually extending its deadline. So the folks that usually come out, the enumerators that come out to households who have not returned the questionnaire, they're delayed until August 14th. And so we have a little bit of time, extra time, in order to make sure that folks have their census questionnaires filled in. So, but all that being said, people should fill out the census as soon as possible, so we have a better indication of where we have some holes in some hard to count communities.
Perfect. Thank you so much. And if you choose to do it by phone, know that there are multiple languages that you can call in. And if you don't want to, or if you know someone that doesn't want to complete it in English, they can do it in a different language. So thank you so much, Tram. Next, we're going to hear from Sanu, and she's with Transitions Family Violence Services. And we've been hearing on the news, Sanu, that, you know, as people are being asked to stay in their homes, that might not be the best situation for all of our folks. I am clicking to unmute you. There you go. You're unmuted now. So we want to hear from you on what is it, the work that you all are doing? How is this impacting different families, and what can we do to help?
Absolutely. So thank you for having me. So we are still operating. We're operating our 24-hour hotline, still accepting those crisis calls for those that are attempting to flee or fleeing abusive relationships, and admitting as many individuals as we can that are in imminent danger into emergency housing. We are coming close to our capacity and have reached out to other community partners and also national partners in what is happening around the country when that happens. So we are leaning on a lot of our hotel partners in the event that we see some overflow. We have suspended our support groups. However, we are still offering individual counseling services, as that's been extremely important to survivors, and they have expressed that concern that that's something that they wanted to continue if they could. And so we are still offering that service. We are still offering systems advocacy. So our court advocates are in court every morning for protective orders, assisting survivors in petitioning, and also ensuring that their hearings go well and result in them feeling safer, along with some safety planning. Our staff are working remotely. We made that tough decision last week, as our staff are the work, and it just feels unconventional for us to do our work at distance. However, knowing that we need to preserve the well-being of our staff to be able to respond in the field. We are still distributing some much needed items to families in the community with a low to no touch exchange, and still compiling a list of what those needs are. And if we have them, we are distributing them. If we don't, we are asking community to help us get those items together. We are accepting only the requested items for donations on Wednesdays from 10 a.m. to 2 p.m. at our main 240 Chapel Street location in Hampton. We, however, are not accepting any household goods, clothing items, and different things like that due to COVID-19. We have also established a quarantine unit in the event that someone that we currently have housed comes into contact with someone or starts to feel symptoms of COVID-19, or if we have someone that is fleeing an abusive relationship and has tested positive but still needs a safe place to recover. So we have identified a unit that we can use for that as well. Due to the school closures, and we totally understand from the Department of Education that decision and support the governor's decision on that, we are putting some supports in place for our families that are impacted by that. We are seeing there are some limitations in transportation to get the much needed equipment and packets. And so I did put a question in the chat box that I'm sure will get answered later. That was a suggestion from a concerned parent. We know that we're going to see an increase in domestic violence. We actually looked at our call volume, and it has increased drastically. We've had to cross-train our entire staff so that we can pull more folks to answer some of the crisis calls that are not only coming through our 24-hour hotline, but through the other lines that we have with request. And so a lot of those calls look like us reminding survivors what their rights are to stay in their homes if they're facing eviction, and supporting what the governor had put in place. We also understand that there are barriers to basic necessities like Wi-Fi, refilling their telephone minutes to stay in contact with us. So we are really leaning on communities and family and friends to speak up and assist their neighbors and their loved ones when they feel that there's tension on the line when they're checking in with them, or if you have not heard from a family member or a friend in days or weeks. So we are going to be putting out some resources out to the community so that they can assist us in our advocacy efforts and seeing those red flags, because we know that isolation already happens without a pandemic, and we know that survivors are experiencing one in their home. So the isolation is increasing some of those needs. We know that these are stressful times, and but we do want to express to the community that, you know, stress is not the cause of domestic violence. We're all under stress right now, but the way that we act with our loved ones is really important in this time where we all need compassion and healthy communication. So we're, again, just before we were stressing to the community how important it was to speak up and say something when you know that domestic violence is happening. If you have a neighbor or a loved one that reaches out to you and says that they need help, they need you to make a phone call, or they need to stay with you a couple of nights, and it does fall into the guidelines of the governor's social distancing and 10-person maximum, then we ask that you lend yourself to them if they feel that they're not safe. So those are a few of the things. I know that we sent some information to Delegate Marcia Price, and tempted to share with you all of some other conventional, unconventional ways that you can contact folks. Our state and national partners have a chat line, because we understand that everyone will be able to use their phone to ask for help. On our website, you're able to send emails. We've already been seeing those come through, requests in the early mornings for assistance and help. And so we just want to make sure that survivors have whatever means possible to communicate to us what they need to feel safe. And so yesterday we saw, unfortunately, our first fatality on the peninsula in York County. That was domestic related, murder-suicide. And so again, we are just urging community members to reach out to us. We are here. If you do not feel safe at home, please give us a call.
Sanu, thank you so much for that very important information. And I know that your question came through, but we're also going to ask more specifically when we're in the question period, how can we further support the work that you're doing? So thank you. And we just have a few more folks that need to talk. So thank you all for your patience. And then we are going to jump into these questions. But for our healthcare response, it is super important that we understand what's being done on the healthcare front. And we have with us the president of Centera Careplex and the vice president of medical affairs, Kapua Conley and Dr. Anthony Fisher. Take it away, guys.
Hey guys, real quick, just wanted to kind of introduce myself, Kapua Conley, president of Careplex. I've got Dr. Tony Fisher, who's our VPMA. We're going to go give a high-level overview of what the system is doing for Hampton Roads, and then dive a little bit of what specifically Careplex is doing for the district, and give you guys at the end opportunity for some Q&A. So go ahead, Tony.
Yeah, thank you, Delegate Price, for allowing us to be here, be part of the conversation. So a little bit, first what the system's been doing. We received extensive support from the system. Centera began conversations when this virus first appeared in China. Our response has been to establish a centralized command center to coordinate strategy and response for a multitude of challenges, which include supplies, staffing, testing, care, training, communications. Careplex itself opened up our command center about 2 weeks ago. We are 24/7 to coordinate all of the necessary logistics on a local level. effort to keep our staff and patients safe, we've initiated a multitude of measures here at CarePlex, which include triaging patients outside the ED. We utilize CDC recommendations and guidelines to screen patients that are high risk for COVID, and if they're positive, they're masked appropriately and moved immediately to an isolation room so they can receive treatment. We've established respiratory units so we can cohort our COVID positive patients and our what are called PUIs, or patients under investigation. We've established a zero visitor policy with exceptions for L&D, for ED, for pediatrics, and for those patients who can't speak for themselves or have behavioral issues. And finally, we've limited access to the facility. And what that means is that we screen any patient coming to the facility that is not a Sentara employee. We've also started community screening and testing on Friday, this past Friday. Patients still need to meet the screening guidelines in order to be tested. The screening is free, and most insurance companies do cover the screening. We do not charge copay, that is waived. And the screening test, like I said, is free. If a patient doesn't have ability to pay, then we do not charge them for the test either. So for the 4 days that we've been doing the test, this is through Monday, we've had a total of 479 people come through, 340 were screened out, and we actually tested 136 patients. We also have a bi-weekly now meeting with all the CMOs in the community, so it includes Riverside, it includes Mary Immaculate, some of the medical groups such as TPMG, Velocity, Urgent Care, and the VA in Langley. We've extended this to all of Hampton Roads now, so this is an effort for us to collaborate and coordinate because we're all kind of in this together and we need to work together. And we've had a very good response to that. Sentara has also established a community hotline. It's been set up to answer questions that the community may have. It's open from 9 a.m. to 7 p.m. We'll be sending out a one-pager that includes a number for the hotline. And questions they've been answering have been, need for reassurance, questions about symptoms, where to go for testing, questions about what they can take for it. Can I take ibuprofen? What medications are available, appointments, etc. So we have received some questions as far as, where should a patient be seen if they feel that they might have COVID? And it's an important question because, as Dr. Julian said, we want to exercise social distancing. So it's important for those that have PCPs to call their office. Most of the offices are set up to do phone screening to give them the appropriate disposition, and also to give them advice as far as how to be seen. If the patient really is not ill, they're instructed on how to stay home and take care of themselves, or they're instructed to come to the office to be tested. Most of the offices are doing on-site testing, and they'll do that oftentimes in the parking lot or from the car if they're doing that testing. Or a lot of offices are doing telemedicine where they're actually doing the appointment from home. And that's really important as well to kind of keep exposure at a minimum for these patients. If someone doesn't have a PCP, then we recommend an urgent care center. Again, call first to see if they want to phone screen you before you present. There's also been a question as far as if you don't have a life-threatening illness, should you go to the emergency room? And the real answer to that is, in general, you shouldn't go to the emergency room if you don't have a life-threatening illness. It's even more important now to minimize exposure, to not utilize ED. The other reason is that you can, in this time, overwhelm our ED. So I would say, there are people that utilize ED as their primary source of medical care. I can speak for Sentara Medical Group. We do have a robust indigent care plan. It's very, very generous, and we encourage folks to call us. We take practically all insurances, and that includes Medicaid. And they're also always increasing their capacity, and we also do telehealth for those patients as well. So that concludes my update. I'm available for questions at the end.
And so real quick, Delegate Price, some of the things that we're looking for, just wanted to make sure that you guys understand that we have been preparing for this for the last 2 or 3 weeks. We feel like we've got a good plan in place and good collaboration on the peninsula with both systems, Riverside and Bon Secours. We have surge capacity here at CarePlex, and we're also exploring opportunities to look at the convention center and converting the Port Warwick freestanding ED into an overflow unit for potential COVID or healthy sick patients. So I think we're in a really good place. Again, we had a little bit of heads up with the system. We mobilized fairly quickly. Like other systems, we are struggling with some of our supply chain, PPE masks and N95s across the country at a premium. We've got a limited supply. We've got enough definitely to maintain operations for the short term, but like most hospitals and most systems, we're struggling nationally, and that are struggling nationally, that's something that we need to keep looking at as far as and hoping the supply chain opens up a little bit. Other things are testing. We're starting to get more testing kits. And as a result, as we get more testing kits, we're going to start doing more mobile screening units. And so we got testing kits last week, and we opened up a mobile screening Friday, Saturday, Sunday, and I think we'll go on for the rest of the week here. So, you know, that's kind of, in a nutshell, things that we're doing, kind of preparing the community and trying to do our best to support you guys.
Thank you. And can you repeat the hours for the drive-through screening and testing?
So it's Monday right now, while supplies last, while we have kits, while we still have kits, it's Monday through Friday, 10 to 2. And then on the weekends, it's 10 to 4, Saturday and Sunday. Again, that's only while we have available testing kits. So fingers crossed we can go another week with what we have now for the community.
Awesome. Thank you all so much. And thank you for the work that you all are doing truly on the front lines. There's nothing else we can say, but thank you. So I just have a few comments, just following up on some of the things that folks have said, and then we're going to definitely jump into some awesome questions that we've gotten. Some folks have asked, like, why isn't so-and-so doing more? And one of the things that we have to not worry about, but just take into consideration is there are federal guidelines that dictate what a governor can do. And then there are legislative guidelines that if it's in the code, even though it's an emergency, you can't just relax the code all the time. And so there are executive powers that the governor may have. The legislative branch on the state level is not in session right now. So I am not in Richmond. But what we are planning to do as of right now, we have reconvened session where we would finalize the budget, which is going to have to go through some significant changes, and also make sure that we deal with any amendments or vetoes. And that's where we might be able to do some things legislatively. And so that's scheduled for April 22nd. That is 140 people coming into close contact with each other. So we're not sure. Sounds like a terrible idea right now, but I know a lot of us are willing to put on whatever equipment we need in order to get that done, because without that budget being finalized, our hands are often tied. But also for the localities, we've had some questions about can localities implement harsher regulations than what the governor has stated. And at some point, we're going to have a tutorial on what the Dillon rule means. But there are things that have to be done at the state level in Virginia, in order for the localities to be able to do things. I wanted to give a real life example that kind of connects something that Kapua said with something that Tram said. And then the other night, Congressman Scott. So when we're talking about these personal protection equipment that our front lines need in the healthcare industry, the ones that were being given to Virginia were based off per capita numbers. And so even census data and you're being counted in 2010 is having a direct impact on the amount of protective equipment that we're getting today. So if you think about 10 years from now, God forbid something like this happen again, you definitely want to make sure that you had been counted in 2020 so that we can get the right number of equipment and things that we need in order to fight those. We are going to get these resource links out to you all, including a number that you can text to find free food for students. What some of the other state agencies are doing in addition to the Virginia Department of Education. When do you need to file your taxes? What do extensions look like? What's the DMV doing? All of those state agencies, it's one nice little website that has all of that information. That will be in the email that comes to you. And just generally understand that every single person that spoke today, we want you to be healthy. We want you to be safe. But government, by design is frustrating. And we have things that we have to do that are slow processes. So we don't have all of the answers tonight. I'm not going to purport that we have all of the answers tonight, but we are going to open it up and start hearing some of your questions. I'm going to unmute all of the presenters, but we appreciate your patience. We appreciate your understanding that that this is uncharted territory for a lot of us. And if there is a question that we get that we don't know the answer to, we will work to get that for you. But I have invited these nice folks, so if there's anybody that you want to yell at, you direct it towards me. But we've gotten some really good questions, and so I'm gonna have Tempest tell us what the first question is, and then I'll repeat it for all of you that want to respond.
So what are plans for high school seniors as far as that?
So this is a question that we've gotten a lot of. High school seniors absolutely distraught about graduation, prom, all of these things that happen. And I know I had all of those experiences, so I get it. So Emily and Leslie, do you have any indication, or are you working on, will there be something that they can do later just to get that feeling of walking across the stage?
Sure. So I think a lot of those decisions, one, are going to depend on how long the situation continues. You know, obviously we know that it's not going to be done in 2 weeks or 3 weeks or potentially even 4 weeks. But, you know, if say potentially that a lot of these restrictions are able to roll back sometime in June or in early July, I think local school divisions will do their best to have those graduation ceremonies for students. These teachers and principals are just as distraught as, you know, the students and families are. We certainly understand that. So I think it's going to be a local decision. We don't have any specific guidance yet, but I think realistically it all just depends on how long this outbreak lasts. Knowing that local school divisions will want to provide those opportunities to students if they're able to.
And we had another question, and I know, Emily, you had touched on it. So there was an article that said basically Virginia won't have SOLs in the headline, but then you read it and it's like, oh wait, that's not quite done yet. Can one of you all touch on where we are and whether or not we're having SOLs?
Sure.
Emily, you got it, or you?
I'll start and then you can chime in as well where I might have missed it. The Secretary DeVos did release last week to the states that there would be a waiver process, a statewide waiver process to waive federal assessment and accountability requirements, which would include our state mandated SOL assessments. The Board of Education does plan to meet sometime next week or the week after to finalize our waiver and get that submitted to the U.S. Department of Education. However, we do plan to have testing windows available hopefully over the summer as well as into the fall, specifically for students that need that SOL assessment to receive a verified credit for graduation. So while the majority of testing may not be occurring, obviously this spring, we are looking at opening up additional windows this summer and into the fall for students who need those assessments or potentially for schools that want to see that growth. Leslie, I'll
Yes, and no, and so Emily, I think captured it pretty well and touched on the fact that so SOL testing for us represents kind of two things, right? It represents a pathway to getting a state, both either a standard or a verified unit of credit, and is a critical part of our kind of accountability and federal accountability and state accountability system. As Emily mentioned, we're exploring flexibility on how to get a waiver from the SOLs being a part of our federal accountability system. We'll continue to think about how that plays into our state accountability system, but are really actively exploring at the moment how to maintain testing for the folks that it will be important for the graduation side of things. So it's a few different moving parts. And I guess technically the answer is still yes and no, but thinking through how we can maintain testing in place that provides flexibility as opposed to a restrictive environment.
Okay. Thank you all. And Congressman Scott, did you have, as the chair of Education and Labor Committee, did you have anything to add from the federal level on SOL testing or education, the quality of education and what's happening right now?
No, basically what we're trying to do is fund the education. In the Senate bill, we expect significant funding to help education in terms of increasing broadband capabilities, increasing the number of, if students don't have iPads or whatnot, and also to, again, the feeding. But basically, it's an infrastructure response from the legislature. The Department of Education is going to have to deal with the SOLs and whatnot.
Okay. And the next question. So the question was, is there an emergency fund for PPE? And I think Congressman Scott, you had touched on that being a part of some of the stimulus packages that you all were talking about. And Kapua, you guys had talked about having the, I guess, the limited capacity. And then I can add that I fully expect that there will be changes in the state budget that would help address, since it looks like, and this is my comment, it looks like we're not getting much help from federal directives from the White House to get that production, then Virginia is going to have to look out for itself. And at that April 22nd meeting is when there will be those changes to the budget that the governor is working on now. Did anybody want to?
Yeah, let me say this. The governor today announced that he was going to try to procure some of this stuff himself. It's obviously getting no help from the federal government. There are a lot of industries in Virginia and across the country that can do masks. It's not that complicated a process. So you may have to convert a textile company or clothing company into something just producing masks. It can be done, but I think the governor has just decided that we got to go on our own and not wait. In terms of there's one problem we've had for the duration of this presidential administration, and that's that OSHA does not have any enforceable standards for protection of workers against infectious disease. There was a regulation that had been worked on for about 10 years. It was ready to go. This administration put it on the back burner. About a year ago, as the chair of the Education and Labor Committee, we wrote and said, what is the problem in getting these enforceable regulations moving, because something might happen. About a month ago, we wrote back and said, something has happened. When are you going to get going on the regulations? In the Families First legislation we had in there, part of the bill was to tell the Department of Labor to get going on the on those regulations. And in order to pass the bill, the Republicans made us take it out. In this bill coming up, we put it back in, and they're still resisting, but the workers are on the front line. We need enforceable OSHA regulations to make sure that they're protected.
And if you're interested in how to communicate with other legislators that would be maybe hesitant on helping pass these sorts of things, we can do an advocacy webinar as well to teach you how to talk to your legislators so that we can get those letters out stating we want to protect our healthcare folks and we need more resources.
And the healthcare workers are the only ones in terms of protection from infectious disease. You've got TSA employees at the airport, everybody who is subject to infectious disease. We need enforceable standards to protect our workers.
Absolutely. Next question. And I'm going to ask this for both Sanu and Karen. What type of items do you all need donated? And Sanu, if you'll go first.
Okay. So we are similar to the food bank. We're asking for non-perishable food items. We're asking specifically this week, we're in need of baby formula, sensitive diapers. We're in need of gift cards for meats We don't have the capacity to store those things, so gift cards would be the best means to do that. We're asking for gift cards for transportation, to purchase Uber and Lyft gift cards for people that are considered essential employees that need to continue to go to work so that they can do that. We're also asking for contributions to support putting individuals in hotels. We're doing week-long stays at minimum in hotels. And cleaning supplies. We ran out of cleaning supplies yesterday to provide to survivors, and so we've got a new list of those that have not been able to find those things to keep themselves safe, as well as, like everyone else, toilet paper, paper towels, just those basic things. So we are again accepting donations on Wednesdays from 10 a.m. to 2 p.m. and we'll be updating the community on our website and on our social media page as that list continues to change, as survivors continue to call in and reach out to us about their needs. The last thing I'll say also is gift cards to add minutes on some of our survivors' phones so that they can continue to stay in touch with us or continue their counseling sessions as well.
Thank you. And what is the process for it? So like, let's say I put some stuff together, I'm coming in on Wednesday between 10 and 2. What does that look like once I get there?
So we're asking that you give us a call at our 757-722-2261 phone number and let us know you are en route. We have cameras at that facility, and so if you'll call us and say I'm outside, we're asking folks to drop off the donation at the front door, and then our staff with some protective gear will come and pick up those donations and bring them into the building just to limit the contact between individuals.
Okay. And Karen, same question. What kinds of items for the food bank would be helpful, or Renee? And then what's your process for donating?
Okay, as Sune said, we do need non-perishable food items. Our basic top 10 list includes peanut butter, pasta sauce, canned tuna, any kind of canned protein, oatmeals, hearty soups, things like that. We are accepting donations at the food bank. If it's a small amount, we will allow the person to come in and place it in our donation box that is inside the food bank, but not in all the way in the lobby. If it's a larger amount, we'd ask them to go around to the back of the food bank where we have set up some larger totes for them to place their items in. We are not distributing that food for 72 hours after we receive it, just kind of to let it settle. The best thing that we could use is, of course, funds in order to purchase food so that we can get case-lotted items of the most needed items. And they can go to our website to donate. They can go to the Facebook page to donate. And all of that's on the one-page sheet that I gave to Delegate Price. And I apologize, my camera wasn't on before.
Oh, you're fine. Awesome. Okay, so we're going to try and burn through some of these questions so we can get to as many as possible. I do know that we are now over the hour mark, but you guys' questions are really good, so we want to make sure that we get your answers for you. So when we're talking about faith communities, so nonprofits and faith communities have had great relationships. So Sanu and Karen, or the school systems as well, if you want to talk about how you're reaching out to faith communities and other nonprofits to do the work that you're doing. And Sanu, if you want to kick that off.
Absolutely. So on the second day that we went remote, the faith community responded and provided us with cleaning supplies, water, everything that we needed to get a few of our sheltered clients till that 2-week mark. And then more church communities started to respond and was able to get us to a 30-day mark, as we just didn't know what was happening as far as how long this was going to last. We are in talks with Liberty Baptist Church and Reverend Cheeks around ways that we can expand capacity for housing individuals, those that also find themselves homeless. So the church community, I think, has rallied and looking at what supports they have and how they can use their sanctuary spaces also to support the mission of a lot of the nonprofits. So we're extremely grateful.
Awesome. Karen?
Yes, as you know, the vast majority of our partner agencies who help us distribute food are church food pantries and other faith groups. And so we are relying on them heavily to help us get food into all the places where we normally would get food. We also have some great financial supporters who are not our partner agencies, but they are other faith communities that will send in donations from time to time. Then I'm gonna ask Renee to speak to this as well because she's a little bit closer to it.
And so we have a lot of our partner agencies that are remaining open. They're doing drive-through distributions of food. So they're maintaining their ability to still serve the community as partners of the food bank. So they are continuing to do fill that need. So when we do the larger pantries, they're still in the smaller communities doing that. So we really appreciate that.
And I do know that some of the churches also have partnered with Newport News Public Schools and Hampton Public Schools in their food distribution. Just a note, if you are planning on doing food distribution, that the expectation is after 11:59 p.m. that you will be using social distancing and making sure that everything is clean. So the selfies and the group pics of while you're doing community activities is not 6 feet. So definitely understand that when you're going around with mobile pantries, or if you're a site for people to come to, folks that are already in need, we don't want to then also put them at risk of getting the virus, which they're home from. So we definitely thank our religious organizations and our nonprofits for the, just great asset that they are with their donations and work. Next question.
So how do we protect ourselves working in a grocery store? There are certain stores that don't allow us to wear gloves anymore and come across people every day.
So there's a specific question from someone that has a job at a grocery store. And so this might be for the health department or for Kapua or Dr. Fisher. They were told that they can't wear gloves at their job at the grocery store. So how can they protect themselves since they're coming into contact with hundreds of people? And Congressman Scott, you might also have something to say about that with the labor laws there, but we'll see what the health have to say.
That's exactly the problem with not having enforceable standards. There's little guidance from the CDC, from Center for Disease Control, but there are no enforceable OSHA standards. And that would be answered by those standards, what kind of protective gear they should have, and they need to be protected.
Awesome. So while the chairman is still fighting for those standards, what can somebody do today for Dr. Julian or Kapua or Dr. Fisher?
So it is difficult because gloves will protect the wearer, but they're in contact with people over and over again. So those gloves might protect their hands, but if the virus gets on their gloves and they touch their face or mucous membranes, they're going to transmit it to themselves. So realistically, they'd have to change gloves with each transaction. And wearing the gloves or bare hands would also increase, or it wouldn't increase, it would allow the same level of transmissibility to the customers as well. It's a really difficult situation. I mean, the really best answer is to have good hand hygiene between each and every transaction you have, using either an alcohol-based hand sanitizer, or at least 60% alcohol, or good hand washing.
Would agree.
Okay. All right. Thank you. So I happen to know the person that asked that question. So we're going to send you plenty of hand sanitizer to get you through that while we're still supporting Congressman Scott and getting those protections in order. Next question.
As a small business owner that provided order to close tonight, that you will need to discuss?
So we've gotten a lot of questions from small businesses, and so we do understand that executive order from the governor, Executive Order 53, does say at 11:59 p.m. there are certain small businesses that just cannot do the social distancing. So we're talking about hair care, nail care, massage. A lot of the trainers and folks that their job is really based on being less than 6 feet away from their clients. And so the question was specific to local, but I'll ask it for local, state, and federal, what's being done to help those small businesses. And so we'll start with you, Congressman Scott.
Well, they're negotiating the bill tonight, and assistance to small business is one of the elements that I believe will be in there. The SBA is doing making significant number of loans. There is support for the idea that if you use your loan money to help pay your employees, that we're going to consider discharging the loan, not collecting the loan. Now, if you take your loan money and stick it in your pocket, well, maybe you need to pay that one back. But assisting the workers, if you have significant unemployment compensation, when the business is closed and not doing any work, they can get unemployment compensation, so you don't have to pay them to keep them on board. But those are the areas that we're looking at: loans, converting them into grants, and helping the employees. The leave, the family leave that we talked about, the sick leave that we talked about, required by the federal government, is 100% reimbursed by the federal government with tax credits. There was one issue that if you have to let somebody go and they're on family leave that you have to pay for, well, they were talking about, well, we don't want to pay their health care premiums. They said, no, pay the health care premiums and you add that for the tax credit. So they can, the employee will get not only the benefit of salary, but also continuation of health care. For a small business, that can make quite a difference.
Okay, and so the federal, what is happening right now on the federal level will then answer the question how I can answer from the state level, which would then impact how Mayor Price could answer. So we are all looking at Washington and hoping that things go through.
And a lot of that is going to be unemployment compensation, because
Right.
If we significantly increase the maximum and pay for it to the federal government, what we're trying to do is have about a $600 addition. The unemployment compensation in Virginia is a couple $100, about $300 and some maximum. If we add $600 to that, we'll be replacing a significant portion of most people's income. And maintaining their income is one of the major things we can do.
And I want to add to that on the state level, looking ahead to next session, there were quite a few bills this session that would have advanced this. And so I don't want people to think that what the situation is now is how it has to be forever. But we are, the governor has relaxed the time frame that it used to take in order for you to apply and start getting your unemployment benefits.
That's a 1 week waiting period.
Exactly. So that has been waived. And then also the governor has also given guidance as to more people than usual that can apply for that. So as Congressman Scott is saying, it may not be a lot, but there are things that you can do on the Virginia Employment Commission site. That
let me say a little more about that. If you take unemployment, you have to be looking for a job and accept a job if offered. Otherwise, you get cut off. That requirement is also being relaxed, and we're also trying to cover people who are not technically employees,
right?
Gig workers, independent contractors, and people will learn under this process the difference between an employee and an independent contractor. We're trying to figure out a way to get them covered, because the employers pay unemployment compensation tax, create a fund, and that's where the money comes from. Independent contractors don't pay into that fund and are not eligible for unemployment compensation under present law. We're trying to get them covered.
And so that means in real life terms, if you're ordering from Uber Eats, DoorDash, and all of that, tip well, because they right now may not be covered in a lot of the things that other workers are. The other thing that we've gotten questions about is restaurants. And so under the order, restaurants can stay open for takeout and delivery. So if you have a restaurant and you're not already signed up with a delivery service and you don't have the capacity to deliver, we would definitely suggest you look into that to give folks some opportunity to get it at home. I know that I've done no contact, just put a note, hey, leave it on the porch. And so there's no contact, but also want to make sure that restaurants are not being racist in where they deliver. If you can go 20 minutes north in Newport News, you can come 20 minutes south into 23607. We definitely need food in our area too, so I just want to put that out there. But trust and believe we are looking out for small businesses. I will have the Virginia Employment Commission website and the website for the loans that Congressman Scott was talking about available, along with some information coming from Mayor Price on small businesses. And I think we have time for 2 more questions. I thank you so much for your time, but there are quite a few more questions, but we're gonna take 2 more.
Can you explain the process for absentee?
Yeah, so Tram, there's a question on explaining the process for someone that this might be their first time voting by absentee. You had talked about the citizen portal. Can you walk one more time through what does it mean, and to include once they receive the ballot, what happens from there? So what does absentee voting look like?
So if you request an absentee ballot to be mailed to you, it will come in a larger envelope. And then there will be inside that envelope a sheet with instructions on how to complete your absentee ballot. And then there will be an envelope that you have to unseal in the presence of a witness, right? So you have to unseal it in the presence of a witness, and inside that envelope will be your ballot. You mark it with ideally a black ballpoint pen, and you put it back. There's a B, they call it a B envelope, that you have to seal your ballot back into that B envelope. Fill out the information on the front of that envelope, including your first name, your last name, your address, and then you have to sign it and then have a witness sign it. You seal that and you send that back into the registrar's office. And once they receive it, they will process it along with all the other absentee ballots that they've received.
Awesome, thank you so much. And we really encourage everyone to participate. Hampton and Newport News have school board and city council elections. It does not look like those dates are going to be moved in either city, but stay tuned, and also feel free to call your local registrar or my office if you have any questions. And our last question, and
Marcia, before you get to the last question, I think you also ought to emphasize the possibility of in-person absentee, which is early voting. That's a simpler process because you go in, fill in all the forms, get your ballot, vote, and that's it. The process that was just explained, you got to send in an application. You got to get an application. You send in the application for the ballot. They send back the ballot. It's too much back and forth. It's much easier to do in-person absentee. Just go in early voting where there are no crowds.
So with the in-person absentee, we're talking about the May election. You still do have to fill out that application to say that when Tram said 2A, that is the excuse, because as of May election, you will still need to have an excuse in order to vote, and you would just go to the registrar's office. We are going to have to see what that looks like, because currently, Congressman Scott, the buildings that those are located in are not open to the public. So stay tuned for more information on that, because I do know that by code, they are also probably going to have some other places open as well for voting. But I want to give a shout out to Tram and New Virginia Majority, because they were very instrumental in us getting these bills passed that will get rid of those excuses. So moving forward, hopefully, maybe to the June election, but definitely to the November election, all of these bureaucratic things that the Congressman and Tram just described won't be the case. But for the May election, No new laws as of yet will impact the May election. So you have that voting in person. We'll get more information on how that would work with the governmental buildings where that happens being closed. But the by mail right now, still have plenty of time for it to come to you and for you to send it back. And so I'm going to ask the last question, and then we'll see if there are any finalizing comments. I don't know that there's anybody on the call that can actually speak to this, but Dr. Julian may have some input. But the question is, it seems like every now and then the governor is getting a little bit more restrictive. Are we moving toward a full shutdown? And if so, when would that be? I don't know that anybody can speak for the governor, but Dr. Julian, can you answer at least with what the governor has done and what you have seen? I know you had mentioned Singapore and Italy. What are you seeing internationally that has been helpful in order for us to flatten the curve?
I think my first comment would be that let's all remember our governor is a physician.
Right.
That's a great thing to have in these times. And he has got great advice, and he is considering that advice, and he will make very considered decisions. So I think we can feel confident there. Obviously, I can't speak for the governor. What we have seen is that in countries wherein significant isolation procedures, isolation mandates are done, that the spread of the disease is lower. And it's just, that's just that simple. And remember, this is a disease that passes through close contact between individuals. So I think if Americans will follow the guidelines that we currently have out, I think it will go a long ways to helping us get to the point where we can bend the curve on this disease.
Awesome. Thank you, Dr. Julian. And to remind you all, 11:59 p.m. this evening is when Executive Order 53 goes into place. And so those businesses that will be closed because they're not able to practice social distancing will be in effect. When you do go to places that are able to have social distancing, it's a maximum of 10 people. So be very patient. And then also making sure that the employees in these stores know how to deeply sanitize the areas, but also taking care of your own protection. Clorox wipes, if you have them. I know that a lot of us pay with our cards, and so remembering that every single surface that you touch, you want to make sure you either sanitize after it, sanitize before, but also really limit the contact with others. They have Food Lion, Target, Harris Teeter. I know that there are others have actual delivery services for groceries. So that's something, if you're able to look into. We'll have a ton of restaurants that are doing takeout to include, I talked with Wing Bistro and a lot of great restaurants that are in the 95th District, Kismet, like a lot of folks that are open and ready, and it's just a matter of it being delivered or takeout, so there's still food access and options. But 11:59 is also when gatherings of 10 or more people are banned in the Commonwealth, and we want to make sure, as Dr. Julian, as Dr. Fisher, as a lot of people have pointed out, this is inconvenient. We get it. But it is important to save lives. And I'm saying that to you as someone that is on the high risk list. My family is doing an amazing job of looking out for me when they go out to make sure that when they come back, they're not putting me at risk. And so as Congressman Scott and so many others have just told about the increase, y'all probably heard 6 deaths and y'all may have been like, oh, that's such a small number. But I don't want you to look at what's happening today. I want you to look at what could happen if we don't listen to this guidance that's coming from the CDC, the Department of Health, and from our governor. I want to thank you all so much for spending time. I know that we went a little bit longer, and so I want to thank our speakers, but just reiterating, wash your hands often, practice social distancing, stay home when you can, telework, check on your family and friends, especially those that you usually hear from but may not have heard from, those that you have this unsettled feeling about what they may be experiencing in their home. Check on them. Check on your strong friends. Check on the ones that are always checking on you, and share the information that you have with others. We'll have this recording available. Don't forget, complete your census. all good reminders. The governor will have daily updates that, well, actually, they're now every other day. They'll be Monday, Wednesday, and Friday at 2 o'clock. Follow all of us on our social media so that you can have up-to-date things. We're gonna give you the links to that. There will be a follow-up email. I'm already telling y'all this email is gonna be a monster, but it's gonna have so much good information. We'll get that out to you by tomorrow afternoon. And then just also take care of yourself. Love each other, take care of each other, but we got to be wise. We got to be smart about this. Thank you again so much to the people that are up here sharing all of this good information. They will also be able to answer any of the questions that we didn't get answered. So thank you for your time, your attention, and we will also be doing another kind of wonkier webinar, but it'll be about some of these great bills. We started talking about elections bills, but there's some really great bills that came out of the General Assembly that are about health, education, domestic violence, like all of the things that we've talked about. They're new bills that will be coming into effect July 1st that I would love to talk about with you, so stay tuned for that as well. Until then, I do want to say thank you again, and you all have a great evening.